So today's hair transplant class, kids, is about necrosis, dead scalp from a hair transplant. It does happen. Hey everyone, welcome back to the Hair Transplant Mentor YouTube channel. My name is Joe Tillman, and if you don't know what a hair transplant mentor is, you can learn all about it at hairtransplantmentor.com. Welcome to hair transplant class number 20. Right, so in today's class, we're going to be talking about necrosis. And before we continue, I need to warn you that if you have a weak stomach, you might want to flip the channel to watching unicorns and butterflies because I'm going to be showing some pretty nasty photos.
Warning, some of the following images are graphic in nature and might be disturbing to some viewers.
Still here? Great, let's get started. First off, what is necrosis? Well, necrosis is quite simply the death of tissue. And the way that it occurs is usually from the lack of blood flow for a sustained period of time. And we all know that our blood flow throughout our body delivers oxygen and nutrients so that every cell can survive and continue to prosper. But if that blood flow gets cut off, like I said, for an extended period of time, then that blood flow, that oxygen, those nutrients cannot get to where it needs, and that area that is starved of blood flow simply dies. And that can happen anywhere on the body. Have you ever seen frostbite? That's what's happening. The digits, like the fingers or the toes, they freeze, and then blood flow stops, and then the area turns blue, just like you do when you start holding your breath. And then eventually it turns black because it's dead. And then that tissue falls off, and it can even become infected. And it can even happen after you have a hair transplant. And this is what I'm talking about. This patient has a lot of incisions on the top of his scalp, and what you can see here in the top, in the middle, is bruising that looks like I was talking about before, like if you've been popped in the face. This is because the area has been traumatized too much. Blood is pooling underneath the skin, and it's going to coalesce and harden, robbing this area of skin tissue of blood flow. And then eventually this spot and the little spots around it are going to turn black and then into pretty deep scabs. And then over the next several weeks you can see that the scabbing gets smaller, it gets more condensed, but then the overall area that it takes up on the scalp diminishes, and eventually it does just fall off and it leaves scar tissue underneath. This patient, regardless of how many grafts he placed, this general area is going to not have any hair. Those grafts are dead. This patient, he documented his own experience after he had necrosis. It's a very large area on top of his scalp. He went to some sort of chain clinic in North America, and I know that there wasn't dense packing involved. This was just a large area where I believe most likely the incisions were made too deep into the scalp, interrupting a lot more tissue and creating more trauma. I also don't think it was dense packing given the area of placement, and the patient was dealing with about 3,000 to 3,500 grafts. So this large of an area with that many grafts is not dense packing. So that was day 15. Here's day 41. You can see that first off, it's a much better quality photo, but the surrounding scalp tissue is inflamed, it is red, is definitely irritated and agitated, but the scabbing itself, it looks like there's some infection going on. And usually when necrosis has set into the scalp, the doctor or clinic will be prescribing antibiotics to try and fight the almost inevitable infection that does occur afterwards. Day 56, the smaller areas of the necrotic tissue have shed their scabbing, and then it's kind of coalesced into the main scab in the center. Then day 69, the surrounding area is settled a little bit, but it's still really inflamed. By day 82, most of the scabbing is gone, 98%. There's a little bit left in the top center, but you can see that the rest of the hair around it is also affected. There's a little bit of growth from the graft work surrounding it, but it's not looking very good. Day 104, and all of the scabbing is gone, and in its place in the center of the scalp is very thin tissue that's trying to recover. When we zoom in, you can see these small capillaries and veins struggling to reconnect and reform in the very top of the scalp, and eventually this is going to become just scar tissue, and while it will continue to get smaller, the peripheral edges will heal and maybe some of the grafts will grow. The central area will be devoid of any surviving grafts. Here's another case that I believe incorporates both coverage and density in one procedure. And when we look at this before image, this is after the procedure and necrosis is already set in. It's over a very large area, but the areas outside, you can see first off that the placement goes from the new hairline all the way back into the crown. So I don't know the details on this, but this is obviously a big procedure. But then when you look at how close they are, it's also a pretty high density based on at least what we're seeing in this photo. And the other thing that I'm noticing is that these grafts look like they're pretty big. So I think that that is probably the big takeaway from this, is that density and coverage are fine. Like big sessions, there's nothing wrong with big sessions. These are bigger grafts that you would find in a clinic that doesn't use microscopes and believes that big multi-hair grafts are the key to density. There are clinics out there like that, and I get it. It can lead to the appearance of density, but if you're not careful, it can also really compromise the blood flow and cause problems like this. 3 months later, give or take, we're looking at some good growth surrounding the scar tissue where the necrosis was, but this is a large spot that is going to have to be grafted to get any sort of normal appearance after he heals up. And that brings me to the next point. Can you have more hair transplants on top of scar tissue after you have necrosis? Well, the answer is yes, which leads into this next case where it's already healed up. You can usually transplant back into the scar tissue, but obviously you want to be a bit more careful when you go and try that. And it can work fine. Like I've seen plenty of cases where there was scar tissue on the scalp from hot oil burns, sometimes from necrosis, and grafting was performed and the grafts did grow. It might take 1 or 2 procedures instead of 1, because you definitely don't want to do a high density pass. So far I've been talking about necrosis developing from the incisions placed on the top of the scalp, and there are 2 reasons why this happens in general. The first being the surgical approach, and the second being the physiology of the patient. I'll talk about that later. Right now, I'm going to talk about the surgical side of things and why necrosis can occur. It's actually quite simple. When experienced hair transplant physicians are making the initial incisions into the recipient's scalp, their experience will let them know if the patient is bleeding normally, if they're not bleeding enough, or if they're bleeding too much. And when an experienced physician sees that the patient is not bleeding enough, maybe it just looks like low blood flow, that's when they'll dial it back on the density and try to avoid compromising the vascularity to the point where it causes problems. But that's not always the case. Sometimes the physician doesn't recognize it and doesn't back off on the density that they're trying to achieve, and it causes too much trauma to a very specific area, and that's where the necrosis can set in. But sometimes necrosis does not occur because of a density issue, but rather because the physician might be inexperienced and doesn't understand the concept of depth control. Yeah, necrosis can happen even if you're not going for a high density. It can happen when the depth of the incision is too deep. And if it's done too deeply in a small area, then that too can lead to too much trauma and the blood pooling underneath the skin, hardening, and then, yeah, I mean, you've seen what can happen. But also the size of the incision overall, not just the depth, but also the diameter, can affect how much trauma is incurred into the skin tissue. And that too can lead to necrosis. So if you have a bunch of incisions that are too big or too deep, or maybe even a combination, it can lead to too much trauma. So now maybe you see that when you're making incisions in the scalp, there's a lot more to it than meets the eye. And this is where experience really does play a key and crucial part of the surgery. Now so far, we've only been talking about necrosis on top of the scalp, which means, yep, it can happen in the donor area too. I'll start off with a strip case. Yes, necrosis can occur in FUT strip cases, and it's usually, the cases I've seen, is due to one simple reason. And before I explain what that reason is, I need to explain how strip closures occur and what is usually the standard issue that most clinics will run into. Better strip clinics understand that donor scalps will have varying degrees of laxity as you move from one area to the next. Every few centimeters along that incision line, the laxity will be different. And there are two areas where it is always tighter than the rest of the scalp during a strip removal. In the back of the scalp near the occipital bone, you've got the mastoid processes, which is through here and through here. And these areas are always the tightest during a strip removal and have the highest amount of tension. So better strip clinics, when they're removing the strip from that area, they will remove it in a much more narrow strip as opposed to the back or the sides. And when they take out a more narrow strip, it means that there's less tension when they're pulling the sides together for the final closure. But when those sides are pulled together and there's a lot of tension and the doctor has to really pull hard on both sides and then they're finally able to staple it or suture it closed, that extra high tension is the same thing as pressure. And if you watch TV or movies, what's the first thing that people yell when someone's got a really bad cut on their leg or arm or somewhere on their body?
Put your hand on, keep pressure on.
Why do they say that? Well, they say that because when you press down on a wound, you're actually pushing the blood flow away from that opening in the skin so it doesn't bleed as much. But that's the same thing that's happening when there's a lot of tension on that wound from a closure. The blood is being pushed away. And if it's too tight of a closure and that pressure is too great, then that area of the scalp is going to be deprived of oxygen for a bit too long, and this can happen. Now the good thing is that as bad as some of you may think having a strip scar is, this can be healed up. It'll heal up as a wider scar than the patient wanted, but it should be able to be a candidate for grafting like beard grafts or other scalp grafts into it, and it'll be okay. The big problem is when necrosis happens after an FUE extraction. Yeah, this apparently can happen when you have an FUE procedure. Now, to be fair, I don't know the details on this. It is certainly a rare situation, just like all these situations are, but it shows that FUE isn't always such a simple procedure. And the only remedy that this patient has, it isn't so much grafting as it is balloon expansion therapy. The logical question at this point is, what can you do to prevent necrosis from occurring in the first place? Well, remember earlier when I was talking about two issues that can lead to necrosis, the first being surgical and the second being physiological? Well, that's where you have some control over the outcome of the procedure, your own physiology. Now, normally you can't really do a whole lot about your own physiology. Your blood vessels are your blood vessels, your body is your body, but you can influence the kind of shape your body is in before you have your surgery. What does that mean? Well, obviously, exercise. Of course, exercise. If you have a strong heart, it means you have a strong circulatory system, which means that your blood flow will be optimum or optimal before you have your surgery. On top of that, eat right, organic meats, green leafy vegetables, so you can't eat them anymore. Can never get too many of those. And don't smoke. Yes, of course, smoking is horrible for your circulatory system, and of course you don't want to compromise that before surgery. So always tell your doctor if you are a smoker, and they'll probably tell you to stop smoking for at least 2 weeks before your surgery. Quit if you can entirely. So that's it, guys. This is a real surgery. Do your research to find surgeons that are experienced. And yeah, I mean, hey, it's your head. You have to live with it. They don't. So if you like this video, I appreciate if you crush that like button. If you haven't subscribed yet, please subscribe. I don't sell anything. This is the way that you can show your support, not by links that I've got to send you to buy something. That's not the way this works. So yeah, I appreciate subscriptions, and of course, ring that bell if you want notifications of new videos, which will be coming out soon. Thanks a lot. Peace.